The Centers for Disease Control and Prevention say it's safe for schools to return to in-person learning in the fall. The agency released its updated guidance Friday. Teachers and students who are fully vaccinated will no longer need to wear masks, and schools are urged to add or remove whatever measures based on what they feel is needed. Meanwhile, there is new confusion about booster shots. Pfizer will be filing for emergency use authorization for its third shot. And while the company says that it may be needed soon, top U.S. health agencies disagree. Nikki Battiste has the latest.
Tonight, pushback from two top federal health agencies on the need for a booster shot. The FDA and CDC telling Americans who have been fully vaccinated in a written statement they do not need a booster at this time. It comes after Pfizer and BioNTech officials announced they were seeking emergency use authorization for a booster because antibody levels in the blood may decline 6 months after immunization. Independent studies have suggested that immunity from full vaccination is likely to remain robust for years, even against variants.
Is there some sort of scientific evidence that would suggest they should look into a booster?
Not at this time.
Dr. Celine Gounder is an infectious disease specialist at Bellevue Hospital in New York.
I think the headline here is that if you have received both doses of the Pfizer or, for that matter, the Moderna vaccine, you are fully protected against severe disease, hospitalization, and death, even with the Delta variant.
Gounder says the J&J vaccine is also holding up well. But cases are rising in 26 states, and hospitalization rates are up in 17 states, 27% in Florida, almost exclusively among the unvaccinated. This as the CDC released new guidance urging schools to fully reopen in the fall, saying vaccinated students and staff do not have to wear masks, and that social distancing isn't a requirement for in-person learning, even in areas with high case rates.
I think that new guidance is essentially meaningless unless you have a way to track who has been vaccinated, who hasn't.
21-year-old Emma Jenks is one of the last people to get a vaccine dose at the Javits Center before it shuts down.
I feel that the people I'm around are much more protected because I'm now vaccinated.
Pfizer tells CBS News tonight it regularly discusses its research program with public health officials around the world. But Dr. Fauci said in an interview tonight they were not given a heads up and that Pfizer's CEO even apologized to him. Lana?
Very interesting, Nikki. Thank you. Dr. Susannah Hills joins me now. She is a pediatric airway surgeon and an assistant ENT professor at Columbia University Medical Center. Dr. Hills, thanks for being here. So Pfizer's anticipating booster shots could be needed between 6 months and a year after initial vaccination. For some people, we're coming right up on that timeline. But as you know, they're filing for emergency use authorization. But in a statement Thursday, the CDC and FDA say that anyone who has been fully vaccinated doesn't need a booster shot yet. I'm wondering, Dr. Hills, can you help make sense of what seems to be somewhat conflicting statements?
Yeah, it is. It's a little bit confusing and unclear. So while Pfizer is asking for authorization to promote a third booster dose of their vaccine, the important thing to know is that there's really not the data or the evidence yet to confirm or truly suggest that that's necessary. In fact, there's studies that have come out of Rockefeller University here in New York and from Washington University in Missouri that show that giving 2 doses of the vaccine or having a dose of vaccine plus having had COVID-19 before elicit really high levels of immunity. By the way, just a caveat to that Washington University study, just because they got 1 dose plus the vaccine in that study does not mean that the guidance is that you only need 1 dose if you've been sick with COVID-19. The guidance clearly is still that everybody needs 2 doses, but the guidance from the CDC, from the FDA, from all of our national health organizations is that 2 doses is adequate protection. We believe it protects patients really well against COVID-19, both the strains we've been living with here and the Delta strain, which is now becoming more predominant.
So make sure you get both shots if you're getting anything other than Johnson & Johnson, and then wait for guidance. In the same time, the CDC is encouraging a return to in-person learning, and they say that classrooms can forego face masks if teachers and students are vaccinated. But Dr. Hills, given that vaccines have not been made available to younger children yet, what should parents of younger children make of this guidance? And what should schools be doing if their staff aren't fully vaccinated?
So that is the question, right? We're getting guidance from the CDC, but what they're leaving out of their guidance is, one, how to know who is fully vaccinated, and then how to enforce these guidelines that if you're not fully vaccinated, you still need to be wearing a mask in school. So that's the part they're leaving up to school districts to decide. I think certainly so that applies to the older kids, the adolescents, people who are eligible for vaccination. So those rules about that are being left up to the school district. The rules and guidance about younger kids are also being left up to the school district. I think from my perspective as a physician working in a hospital where I'm treating kids who have COVID-19, I've seen kids get really sick with this disease. And I still see patients of mine regularly who are under the age to get vaccinated testing positive for COVID-19 just on a screening basis, or when they get slightly ill and we're doing testing, it's happening routinely on an outpatient basis. I feel strongly that parents should be using masks for their kids who are going back to school who have not yet been fully vaccinated. The downside of getting this virus, if you get a complication for a child who's unvaccinated, is really severe. There's a multi-system inflammatory disease that kids are getting with COVID-19, happens in about 1 in 1,000 kids. And it's really severe, and kids are ending up in the hospital. So I'd much rather see parents be masking their children, be taking that extra step until their kids can be getting vaccinated, because I think the downside of getting the disease is really pretty scary when kids get this multi-system inflammatory disease.
So your recommendation is for those younger students
kids who
still
aren't
have those necessary
vaccinated
precautions.
To wear a mask if you're not fully vaccinated. Yeah.
But let's talk about some school-age children who are eligible for the vaccine. My producer just gave me this statistic. Just over 24% of adolescents aged 12 to 15 who are eligible for the shots are fully vaccinated. Only a quarter of them. What do you believe is behind these low numbers? And what is your message to parents of these children?
Yeah, thanks for asking that, Lana, because I do want to speak to this issue and just really encourage parents to go ahead and feel safe, feel comfortable getting their kids vaccinated. We now have millions and millions of Americans who've been vaccinated, and now we have millions of children who've been vaccinated, and the rate of side effects is incredibly low. So we're seeing that kids are getting vaccinated, they're being well protected, and they're having very good response with extremely rare side effects. I think the reason there's so much hesitation about getting kids vaccinated is because, or at least one of the reasons, is that it's not been fully approved by the FDA yet. So, I am hoping that the FDA will grant full approval to these vaccines, to Pfizer, to Moderna, to Johnson & Johnson for adults. And I hope that they also grant their Pfizer vaccination full approval for the adolescent population soon. And I think that's one of the reasons that parents, that I'm hearing in my own clinic, in my own practice, why parents are hesitant. They're waiting for that full approval.
But even without that full approval, your recommendation to your patients are?
It's super safe. We have so many people who've gotten the vaccine now. We have more than enough cases of people who've gotten the vaccine, millions and millions of people who've gotten it, millions of children who've received the vaccine. So we have ample evidence that it's safe. We have such a high number of people getting this vaccine of varying ages in such a short amount of time that it's like doing a study in an incredibly short amount of time, that typically in a less emergent situation, outside of the setting of a pandemic, you do a study and it would take a long time to gather this many study participants. Right. Well, now we've got millions very quickly. We have good evidence now that it's safe.
All right. Dr. Susannah Hills, thank you.
Thanks, Lana.